Hello guys, welcome to my YouTube channel. This is Calvin here, and I'm doing my MBBS second year right now. So today, my topic will be like I will be discussing about the anti-tubercular regimen to you guys. So before starting this topic, I want you guys to actually think about certain things. Suppose I'm getting a patient of UTI, urinary tract infection. So for that patient, what I will do is uh, I'm giving macrolides. You know, macrolides are erythromycin, clarithromycin, and azithromycin. So I'm giving azithromycin. That is only one antibiotic I'm giving to that particular patient of UTI, and that patient is now okay. He or she is now fine. So in the case of anti-tubercular regimen, why do I have to use multiple drugs? I'm using four drugs. What are the four drugs? HRZE. H is going to be isoniazid, and R is the rifampicin, Z is the paracetamide, and E is the ethambutol. So why it is necessary for me to use four different drugs in the case of anti-tubercular regimen? Why do you think like I have to use four drugs? Do you think our body is very weak, our immune system is weak, or do you think the TB bacilli, which is very smart enough to invade our immune system, and that is the reason why we are using these many drugs to attack the TB bacilli? And also the duration is like 6 months. We have to use this drugs. Of course, we need to use the drugs for 6 months, right? That is very common. Everyone knows. For TB, we used to use for 6 months. So anti-tubercular regimen is actually defined as standardized and combination of potent anti-tubercular drugs. So we are using combination of potent anti-tubercular drugs which are being administered in fixed doses for a fixed defined duration. Okay. Now the objective of this regimen is threefold. That is gonna first one is to achieve the cure. So first one is what? We have to achieve the cure. And second one is what? We have to prevent the relapse. And third one will be the avoiding the emergence of the drug resistance. So in tuberculosis regimen, we use the standardized combination of anti-tubercular drugs in fixed doses for defined duration. The objective of this regimen is first one is to cure, second one is to prevent the relapse, and third one is to avoid the emergence of drug resistance. So this is all about the definition. You can just write the introduction anti-tubercular regimen like this in your answer sheet. And next one, before talking about the core principles, I just want you guys to have an imagination right now. What is this story is very simple. I just cover this in very few minutes. Okay. So now what happens is like there is an army. There is an enemy army which is now entering into our country. Now the enemy army is now entered into our country. They have invaded our country. Now this enemy army is present in all the four regions of our country. That is, they are present in the north, they are present in the south, they are present in the west, as well as they are present in the east. Now this enemy army is present in all the four directions of our country. Now what will our army will do? Our army, every army team will go and attack the enemy army. Yes or no? They are going to attack the enemy army in all the four directions. Similarly, what happens is our our body is our country. So right now, imagine our bodies are like our country. Now the TB bacilli is the enemy army that have been invaded into our body. Now this TB bacilli will be present in our body in all the four different locations. Suppose this TB bacilli, it is actually present inside our macrophages. It is multiplying in our macrophages. Now this TB bacilli is present in the acidic environment, and it is present in acidic environment. It is multiplying in the acidic environment also. You get it? And now third one, it is like actively multiplying intracellularly and extracellularly. It is present in our macrophages. It is present in our acidic environment and multiplying, and it is also in dormant phase. Dormant bacilli is also being present. Now, for all these bacilli, which are located in different locations of our body, we have to use multiple drugs to go and act on them. I cannot use only one drug. I cannot use only, see, मान लो अगर there are different enemy armies are there that have invaded my country, that have been invaded our country. Now our army is going on. If our army is going and attacking only one specific location, do you think the enemy army numbers will get decreased? No, they are going to continuously attack us. Only one of the place our army is acting. Other places there is no army to attack them, right? Similarly, if I'm using only one drug, suppose I'm using only isoniazid, this isoniazid will not go and attack the bacilli which is been multiplying in the acidic environment of our body. You get my point. So that is why I have to use multiple drugs in the case of the tuberculosis regimen. So anti-TB regimen, I have to use different drugs, multiple drugs. So always there must be a combination therapy utilizing the multiple drugs simultaneously and adequate dosing and duration. So what happens is there is an now the invasion. So suppose there is a sudden invasion of enemy army into our body or into our country. Our army will go, every team of the army will go and attack the enemy army. Yes or no, they are going to attack the enemy army. What happens is they are going to attack the enemy army continuously. So 247, there will be an war. There will be an attacking phase where continuously every army of our country team, they will go and attack continuously the enemy army so that the number of the enemy army gets reduced. Similarly, these drugs, all the 4 drugs will be used in the case of the intensive phase, that is of 2 months. This 2 months, there will be a continuously attacking, these drugs will continuously attack the TB bacilli so that the bacterial load, that is the bacilli load, is now decreased, getting reduced. And now metabolic coverage. As I told, the bacilli which is located in the acidic environment, I have to use specific drug so that that specific drug will go and attack the acidic environment bacilli. The bacilli which is growing in the acidic environment, for that to be killed, I have to use one of the drug, that is pyrazinamide. So the drugs should cover the metabolic thing. That is acidic environment also it should cover. And next one is the compliance and regularity are the essential necessary things in the case of the TB therapy. So this is what I have told you. There will be an intensive phase for 2 months. So whenever there is a war or whenever there is a sudden invasion of the enemy army into our country, similarly, the TB bacilli is now entered into our body. Now all the army which is going and attacking all the different zones in our country. Similarly, all the 4 drugs which is our army, that is our body's army, is all the 4 drugs: isoniazid acid, rifampicin, pyrazinamide, and ethambutol. These 4 drugs will go and attack continuously. That is going to be the intensive phase. That is going to be for 2 months. And next will be the continuation phase. Now what happened? The bacilli load is being decreased. Now what happened? The bacilli load is decreased. So whenever the bacilli load is decreased, I will be using only the 2 drugs. Now it is not necessary for me to use all the 4 drugs because now our army is there. Our army have been attacked all the regions of our country. Now the enemy army is now reduced. And now with the enemy army is reduced, only few enemy army is present. So for that, it is not necessary for our country or for ourselves to send all of our army team and go and attack them. So only few army team is enough for the rest of the enemy army to be killed or to be attacked. Similarly, for the rest of the bacilli, that is the dormant bacilli, to be killed, I will use a continuation phase. Only 2 drugs I will use. That is the isoniazid H and rifampicin R. You get my point. So there will be an intensive phase, active destruction, active killing phase of the bacteria. That is the intensive phase for 2 months, and the continuation phase, which is for 4 months, I will use the 2 drugs, that is isoniazid and rifampicin. So this is the drug and the daily adult dosage, where isoniazid will be 5 mg per kg per day. So remember, like isoniazid, which is the HRZE. Remember the order: HRZE, isoniazid, 5 mg per kg per day. Rifampicin will be double the times of isoniazid, that is 10 mg per kg per day. So the maximum dose also like this. Maximum dose of isoniazid is 300 mg. Rifampicin will have double the times, which is going to be maximum dose 600 mg per day. And pyrazinamide, which is going to have the maximum dose among all the drugs. Pyrazinamide will have the maximum dose, that is 20 to 25 mg per kg per day. This pyrazinamide will act against the acidic environment, acidic bacilli, and kill them. Ethambutol is like a security. Now there is a security guard. What he will do is he will restrict the people entering into our home, right? He or she will restrict the people entering into our home. So ethambutol actually makes sure that there is no relapse, as well as there is no emergence of the resistance. So ethambutol does that. So if I talk about the mechanism or the roles of the HRZE, that is isoniazid, rifampicin, pyrazinamide, ethambutol. If I talk about isoniazid, what it will do is it will actively kill the bacilli, multiplying bacilli. Multiplying bacilli को actively kill करेगा ये isoniazid. और rifampicin की बात करेंगे. Rifampicin क्या करेगा? Rifampicin is like someone removing the bacilli. So rifampicin will act on the extracellular bacilli as well as intracellular bacilli. Wherever it sees the bacilli, it will actually kill the bacilli. That is the role of rifampicin. And pyrazinamide, third time I'm repeating this again. Pyrazinamide, it will act on the acidic environment, acidic bacilli को kill करेगा ये pyrazinamide. And dormant bacilli, that is going to be ethambutol. Ethambutol acts like a security which is going to prevent the relapse as well as the emergence of the drug resistance. That is the role of ethambutol. So do you want now? I hope you all get why we are using HRZE, isoniazid, rifampicin, pyrazinamide and ethambutol. Now, what is the advantages of this short course chemotherapy? That is going to be 95% of the cure rate. And it should have patient adherence and then rapid conversion, public health risk. Like what happens is like you have to write about the 95% cure rate. Then you will talk about the regularity and compliance is necessary. And it have to cover the multiple metabolic states over multiple metabolic states and everything. So if I talk about the modified treatment regimen, suppose I am getting a multiple drug resistant TB. Do you think I will use the HRZE, isoniazid, rifampicin, pyrazinamide, ethambutol? No, I will not use these drugs. These pyrazinamide, rifampicin, ethambutol, and isoniazid, all these drugs, HRZE is actually the first line anti-tubercular drugs. I will not use in the case of the multiple drug resistant TB. I have to use the second line anti-tubercular drugs. Second line anti-tubercular drugs will cover in the next class. But as of now, we have to think about these things. Whether we can use in the case of MDR-TB. No, we cannot use all the HRZE in the case of MDR-TB. I hope you get the point. And TB, HIV infection, like in the case of the HIV person, they are getting HIV, they are getting TB also. In that case, what I have to do is I have to make sure that the monitoring of the drug-drug interactions, the rifampicin with the antiretroviral drugs, whether there is any drug-drug interaction is there or not. And then in case of pediatric tuberculosis, the dosages must be strictly weight-based with the child. Now, this is a mnemonic that I have for you guys, HRZE. Now, H is for hunters. H is for hunters. That is going to be isoniazid. So, what hunters usually do? Hunters actually shoot, right? So, they will actually shoot. So, hunters का काम क्या है? Hunters shoot करेगा ना? So, hunters actually shoot it. Shoot. So, isoniazid, they are fast shooters. मतलब क्या है? They kill the actively multiplying bacilli. So this is the hunter. Now this guy is the hunter. This is the isoniazid. He is actually killing the actively multiplying bacilli. Now just take a screenshot of this. अगर आपको ये सब ड्रग्स का काम क्या होता है कि बाद में याद करने के लिए you can take a screenshot. It will be very easy for you guys. H for hunters, H for isoniazid. This guy is isoniazid. Now he is actually killing actively multiplying bacilli. Okay, and now this is for 2 months, the attack phase. So whenever there is a sudden invasion of the enemy army into our body, that is the TB bacilli came into our body. So we have to continuously attack it 247, right? So that the number of the TB bacilli is getting reduced. That is the attack phase. I will use all of my soldiers, all of my drugs, HRZE I'm using. This is the attack phase. Isoniazid, fast shooter. Okay, and next one was what? Rifampicin. Rifampicin R for what? Rifampicin R for what? Remove. Hunters remove zombie enemies. R for remove. So what R means? Rifampicin actually removes the bacilli everywhere. So rifampicin is like commander. It is actually removes R for remove, R for rifampicin. It removes the bacilli wherever, everywhere, wherever rifampicin sees a bacilli, it is actually killing them. That is like a commander, which means what? This rifampicin will act on intracellular as well as in the extracellular environment and kills the bacilli actively. And Z is for pyrazinamide, zombie. Z for pyrazinamide. This is the fourth time I'm repeating you guys that it is acting on the acidic environment and kills the acidic bacilli. And then ethambutol, I have already told, this is the second time. Ethambutol is like a security guard. He's like someone who's resistance. He will prevent the resistance and he will prevent the relapse of the TB. So this is the work. So isoniazid, rifampicin, pyrazinamide, ethambutol, HRZE, hunters remove zombie enemies. H for isoniazid, R for rifampicin, it completely removes the bacilli wherever it sees in both intracellular and extracellular environment. And Z for pyrazinamide, which is actively against the acidic bacilli. And E for ethambutol, which is like a security guard, which resists the bacilli, that is resisting the it prevents the resistance as well as the relapse of the TB. So this is the mnemonic that I have for you guys today, so that you can easily remember all these things. So whenever it has been asked in your question paper, write about the anti-tuberculosis regimen, about the objectives. One is to cure, and second one is to prevent the relapse, and third one it is to prevent the emergence of the drug resistance. And we will always use combination therapy, and we will talk about the phase, that is the intensive phase, which is actively killing phase of the bacilli for 2 months. And then we will use like for the next 4 months will be continuation phase. There are dormant bacilli that have to be killed, right? So in that case, I will use only two of my soldiers, that is two of my drugs, isoniazid and rifampicin, that is actively going to act on against the dormant bacilli and kill them. So this entirely 2 plus 4 will be what, 6-month TB regimen. So I hope you will, I hope you guys got to know, have an idea about the anti-tuberculosis regimen. Always remember, this is the first line anti-tubercular drugs. I cannot use the HRZE in the case of the second multiple drug resistant TB. In the case of MDR TB, what we will call MDR, multiple drug resistant TB, I will use the second line anti-tuberculosis drug. So as of now, this is all about this lecture. In about 15 minutes, the entire tuberculosis regimen has been covered. I hope you will understand this lecture and do let me know in my comment section. Thank you guys for listening to my lecture.